Hi, beautiful people. It's Wonderful Wednesday. I'm April Rowe, your ER doctor online. It's November and it's also National Diabetes Month. So, in this video, I'm going to be discussing the types of diabetes, how to treat diabetes, and the complications if you're not properly managing your diabetes. First off, I want to start with type 1 diabetes. In this condition, the body does not produce insulin. Insulin is a peptide hormone that takes glucose out of the blood and helps to get into the cell so that the cells of the body can do what they need to do. So normally, when a person eats carbs, the body breaks it down into blood sugar or glucose. So that glucose is in the blood, and then insulin helps it get into the cell. So again, in someone who has type 1 diabetes, they're not producing insulin, so they can't get that glucose into the cell with insulin's help. Therefore, the primary management for their diabetes is insulin injection. So the next type of diabetes that I want to talk about is type 2 diabetes. In this type of diabetes, the body produces insulin, but it does not use it properly. It's kind of insulin resistant. So in this type of diabetes, the primary management includes diet and exercise. So reducing your sugar, reducing your carbs, and staying fit with exercising. The next type of diabetes that I want to mention is gestational diabetes. This is a type of diabetes that is developed when a woman gets pregnant. Now, you don't have to have diabetes to get gestational diabetes, and just because you have gestational diabetes does not necessarily mean that you're going to continue having diabetes after you deliver the baby. In this condition, gestational diabetes, the primary management also includes diet and exercise. But of course, and I forgot to mention also in type 2 diabetes as well as gestational diabetes, if diet and exercise are not working, then you can be put on oral medications or pills in order to help manage the diabetes. And obviously, if that does not work, you may need to add on insulin injections as well. But again, primarily diet and exercise. If you're doing what you're supposed to do in type 2 diabetes and in gestational diabetes, diet and exercise can be very effective. Another condition that is not technically diabetes, but I really want to mention because it's very important, is pre-diabetes. You know, some people kind of blow off pre-diabetes because they're like, well, I don't have diabetes yet. And pre-diabetes is classified as someone whose hemoglobin A1C, which, side note, hemoglobin A1C is a measure of kind of how your body has been managing sugar over the past 3 months. Okay, so in pre-diabetes, your hemoglobin A1C is anywhere from 5.7 to 6.4. So if you are in that range, your A1C is 5.7 to 6.4, then you are pre-diabetic. Now, primarily, again, diet and exercise is going to be your friend because you don't want to get diabetes, okay? If you're in the pre-diabetic stage, you can totally prevent diabetes by eating healthy, reducing your carbs and sugar, and staying healthy and fit with exercise. Very important. And why do you want to do this? Let's talk about complications of diabetes. And I kind of want to make an analogy or give you a picture that is very exaggerated, but just to make you understand what the body is going through when you have diabetes. So if you're eating collard greens or you're eating a salad and it's good, it's the best you ever had, right? And I go dump a bucket of sugar on it, you would agree that I just ruined your side dish, your meal, whatever, your collard greens, your salad, you'd be pretty mad at me because it's ruined. That's kind of like what the body is, like how the body state is in diabetes. Everything in the body has sugar added to it. So it's not functioning as well when over time it's dealing with all this excess sugar over and over, day in and day out. Okay, so the complications that you can get in diabetes include nerve damage. Okay, so a lot of people will have a complication of peripheral neuropathy where they say they feel either like tingling or pins and needles in their feet, or even to the point that their feet are numb and they literally cannot feel it. That is why it's also important, side note, for people with diabetes to wear shoes at all times when you're up walking around, and also get in the habit of checking your feet for wounds, because if you do have peripheral neuropathy and you're stepping on things and you're getting cuts on your foot or scratches on your foot, that can lead to a wound. And that leads me into the next major complication, foot and limb injuries. Because in diabetes, all the excess sugar are in the blood vessels and everywhere, wound healing is poor, which leads to, a small little scratch turn into a little wound, which turn into an open hole, which turn into an infected ulcer, which ultimately leads to amputation of a toe or a foot or a leg. This is a common problem in diabetes, okay? A little scratch can lead you all the way to amputation of a limb. Another complication in diabetes includes anything in the cardiovascular system. So blood vessels, okay? Vessels of the heart, you can get a heart attack. Vessels of the kidney, you can end up with kidney failure. These vessels of the eye, you go blind. These are common complications of diabetes that people don't think about when they're, in the pre-diabetic stage or they're first diagnosed with diabetes, and they're like, oh yeah, I can deal with this, but then they let their diet go or they don't take their meds. They don't really think about the long-term complications of diabetes. And that's why I kind of wanted to bring it to the forefront in this video, because it is a very manageable condition and these complications are totally preventable. And like I said before, diet and exercise is your friend in this condition. So I just wanted to talk to you about all of those things. Again, diet and exercise, diet and exercise. I hope you learned something from this video. I'm so glad that you decided to join and share with me on this wonderful Wednesday. If you have any comments or you want to hear about any other topics, you can leave that in the comment section below. But again, thanks for sharing this wonderful Wednesday with me. Be blessed and stay healthy.